All right, so I'm going to discuss with you all a little bit about the herb called Eleuthero. I'm getting my information from a book published by the American College of Healthcare Sciences. The author would be Doreen Peterson. So Eleuthero is in the Araliaceae family. The Latin name would be Eleutherococcus centicosus, also known as Acanthopanax centicosus and Hedera centicosa. As far as common names for Eleuthero, that would include Eleuthero ginseng, siwujia, devil's bush, Russian root, shigoka, Siberian ginseng, thorny bear of free berries, touch-me-not, untouchable, usuri, Usurian thorny pepper brush, wild pepper, and Wu GP, or Wu GIP, excuse me. So there are many common names for this herb. And as you heard, what we commonly, or probably most of us have heard, is Siberian ginseng. It's important to note that that is a very specific ginseng. It is not to be confused with Panax or American ginseng. It's completely different. Eleuthero is used as a stimulant. It stimulates the appetite, also urination. It's a diuretic. It stimulates the immune system. It's also an adaptogen, which means that it's an herb that helps your body increase resistance to environmental stress, and it improves overall vitality. It's also good for normalizing blood pressure. Again, it's an adaptogen, so it helps your body adapt throughout the day. If your blood pressure is too high, it'll lower it. If it's too low, it'll raise your blood pressure. Also helps in cases of atherosclerosis, pyelonephritis, craniocerebral trauma, rheumatic heart disease, neuroses, insomnia, Alzheimer's, ADHD, chronic fatigue syndrome, diabetes, fibromyalgia, rheumatoid arthritis, the flu, chronic bronchitis, tuberculosis. It reduces the toxicity of chemotherapy. That's pretty amazing. It also helps with the herpes simplex type 2 infections. It helps increase work capacity. It has been thought to improve athletic performance, though looking at studies, there's not much to back that up. And it's used more in skincare products. It's not used in foods. So looking at Eleuthero a little bit further, the parts that are used would be the root and the leaf. It is safe as long as you use it within a short period of time. You don't really want to use it longer than a 3-month period. If you know much about active constituents, or you could say the active ingredients of this herb, that would include carbohydrates, coumarins, lignans, phenylpropanoids, triterpenoids, and essential oil. Also, sesamin and isofraxidin is found in the stem, and flavonoids are found in the leaves. Most commonly used would be the root. Its active compounds are called eleutherosides. These include saponins, coumarins, lignans, what I mentioned earlier, the phenylpropanoids, betulinic acid, vitamin E, and provitamins like beta-carotene. What's amazingly interesting is that several constituents are thought to have both antioxidant and anti-cancer effects. There is some evidence that coniferyl aldehyde, that constituent particularly, protects DNA from breakage caused by UV light, and some preliminary evidence suggests that Eleuthero might prevent damage in ischemic stroke. Now, the anti-cancer effects include an anti-proliferative effect on leukemia cells. As far as it being an adaptogen, again, it helps with stress. It may, though, have a hypoglycemic activity, so you have to be careful. If you're taking medications that already lower your blood pressure, it could make your blood sugar, can make your blood sugar too low. But with blood pressure, if you're taking Eleuthero with some things that are supposed to help with high blood pressure, Eleuthero can cause palpitations, tachycardia, and hypertension. So if you have cardiovascular disorders, like atherosclerotic or rheumatic heart disease, you need to be careful. It could also cause headache and pericardial pain, or heart pain in patients with rheumatic heart disease. Women who have hormone-sensitive conditions should not use Eleuthero because it might have estrogenic effects. So if you've dealt with breast cancer, uterine cancer, ovarian cancer, endometriosis, or uterine fibroids, you do not want to take Eleuthero. It could also worsen a heart attack and psychiatric conditions like hysteria, mania, and schizophrenia. They really don't have enough studies out there that would suggest the safety during pregnancy or while breastfeeding, so it's best to avoid taking it just in case while you're pregnant or breastfeeding. All right, most of the adverse effects would come with really taking more than what is suggested as far as dosage is concerned, so just take the right amount. I won't go into everything that it can cause otherwise, but it's not good. If you use this herb at the same time that you are taking other herbs that affect platelet aggression, it could cause bleeding. Those would be herbs like angelica, anise arnica, asafoetida, bogbean, poplar, prickly ash. There's quite a few, even vitamin E and turmeric, licorice, onion, different things. So you gotta really be careful. But yeah, research it because there's quite a few here actually. Also, if you take it at the same time you're taking herbs with sedative effects that help you sleep, it could enhance the effect or cause adverse effects. This would be different herbs like Siberian ginseng, calamus, calendula, catnip, even celery, skullcap, wild carrot, ashwagandha, and really quite a few more. So again, do a little more research, what those sedative herbs would be, and also what those herbs would be that would cause platelet aggression. And do not take Eleuthero at the same time. So that's pretty much all that I have to share with you right now as far as Eleuthero. Please be careful when using it. It can be a wonderful herb. It helps with so many things, as I mentioned before. But again, it can be quite dangerous too if you're taking it in conjunction with other herbs or prescription medications. All right, y'all have a wonderful afternoon.